Hi, my name is Kathryn Cook, and I'm completing my Master's of Public Health and Nutrition at Liberty University. As a registered dietitian working in long-term care, I chose to do my practicum in the long-term care setting. My practicum enabled me to go beyond my current role as a dietitian, and I conducted the majority of my practicum in 5 long-term care facilities located in Central Alabama. Next slide, please. The purpose of my practicum was to summarize the literature regarding the nutrition-focused physical assessment of malnutrition in long-term care. I used this literature to develop best practices and methods for development of a nutrition-focused physical exam in the long-term care setting that long-term care setting dietitians could use. I completed a review of data in the long-term care setting and used this information to develop educational materials on the nutrition-focused physical exam. Next slide, please. The nutrition-focused physical exam is a newer tool for dietitians to assess patients for malnutrition. The registered dietitian should complete the physical exam as part of a complete assessment, and the registered dietitian needs to visually examine the physical signs of nutrition status in order to complete it. The nutrition-focused physical exam was designed to expand upon traditional physical exams. Typically, nursing screens for physical signs of malnutrition, but there's a need for the nutrition physical exam to be conducted by the dietitian. The nutrition-focused physical exam is important because lab values that are traditionally used to assess for malnutrition these lab values might be unreliable or unavailable. Other biometrics such as weight history might also be unreliable or unavailable. And the nutrition-focused physical exam helped in making a nutrition diagnosis and implementing a plan of care that's appropriate and tailored to the resident. Currently, 27% of dietitians use the nutrition-focused physical exam, and even fewer dietitians that work in the long-term care setting actually utilize this nutrition-focused physical exam. Next slide. My first objective was to review previous research articles on the nutrition-focused physical exam. My first objective included a systematic review of previous articles on malnutrition and oral health status in elderly residents in long-term care facilities. This review found that malnutrition is often underassessed and often results from poor intake of food and nutrition sources. Another study found that geriatric and palliative care patients were at increased risk of pressure injury if they had a body mass index below 24, whereas a normal body mass index range is 18.5 to 24.9. So they're at a risk with a body mass index at the high end of the normal range. Next slide. My second objective was to determine the best practices to determine the methods for steps to develop a nutrition-focused physical exam, and then, of course, present on that nutrition-focused physical exam. In order to do this, I needed to gather physical data from the residents living in long-term care facilities. The nutrition-focused physical exam is a comprehensive head-to-toe exam, but the main deterrent for long-term care dietitians is that a head-to-toe exam is not always appropriate. Often the long-term care residents might be brittle or frail, and that's not appropriate for them to be moved around a lot for this physical exam. Also, the dietitian is often a contract employee and does not have the privileges to physically contact the residents without assistance from a nurse or a different person. So I decided it would be best to use multiple markers that would be easily attainable across the board from a multitude of the long-term care residents. I chose to use the body mass index of each resident. A body mass index is a calculation of weight to height ratio that classifies an individual as underweight, normal weight, overweight, or obese. I also chose to use if they had the presence of pressure ulcers, which is an injury to the skin that can be caused by poor nutrition status or other factors such as pressure to the area, such as sitting or lying on an area. And then my final component for my data collection was I chose from the nutrition-focused physical exam to use the temporal region right here. And I chose this because it's easily visible in each resident. It's the least invasive. It doesn't require a lot of movement around. Patients have clothes on. You don't have to pull the clothes off or move them or anything like that. With temporal wasting, it's categorized as severe, non-severe, or normal. Severe includes a hollowing in of the temporal region or a scooping or depression. Non-severe is a slight depression, and then normal has a well-defined muscle mass. In addition to collecting this data, I wanted to make sure that I presented it and utilized it to help other dietitians. So I decided that the best way would be to create a PowerPoint educational presentation to educate dietitians conducting the physical exam on the importance of it and how to conduct it. But I felt like the educational presentation needed an additional component. So with some really great brainstorming and thought-provoking reviews from some of my classmates, I decided to design a pocket guidebook as well. And this pocket guide would be a quick reference guide for dietitians to use after they went through the PowerPoint educational presentation. Next slide, please. For my third objective, which was my final objective, I evaluated my data and developed the educational tools and the educational component. The data collected included 80 long-term care residents, 51 of those were females, and I found that the majority of females, 78.43%, had a body mass index in the low normal range, which puts them at risk for complications from malnutrition. However, the majority of males, 30.3%, had a body mass index in the overweight range, which is actually desirable for the geriatric population. I found that the majority of my females, 54.9%, had non-severe temporal muscle wasting, while the majority of males had no temporal muscle wasting. The majority of females, 32.14%, with non-severe temporal wasting, actually had a body mass index in the overweight range, and the majority of males with non-severe temporal wasting had a body mass index in the normal range. So I felt that these statistics showed that body mass index isn't a sufficient indicator of malnutrition. People in the normal range and the overweight range that are still experiencing some non-severe temporal wasting. Next, I found that 48.78% of females that had no pressure injuries still had non-severe muscle wasting in the temporal region, while I found that the majority of males, 57.14%, that had one pressure ulcer, had a normal temporal region. Again, reinforcing the idea that there needs to be multiple indicators of assessment for malnutrition. Next slide, please. With this data, I was able to develop an educational tool that explained what the nutrition-focused physical exam was, as a lot of dietitians still haven't had a lot of experience with it or exposure to it, how to conduct it, why we're conducting it, and then I put in visual pictures and charts and diagrams on how to conduct it and showed kind of what like the temporal wasting would look like with example pictures, things like that. And then I used that information to create a pocket guide, and a lot of that information is summarized in this handy pocket guide, which is the Malnutrition and the Nutrition-Focused Physical Exam in Long-Term Care, a dietitian's pocket guide. So the first page includes a little chart, and it shows what the exam area is going to be, what severe for that exam area looks like, what non-severe muscle wasting looks like, and then what normal looks like. And the exam regions on this were the upper body, so it's temple, clavicle region, and then the hands. And then I did the lower body as well, severe, non-severe, normal, and that included the quadriceps, the knee, and the calf. And then to expand on that, I also did some vitamin deficiencies and kind of what that looks like on the human body. So I listed the vitamin and then maybe some signs and symptoms of the vitamin deficiency, such as cracked lips might be a riboflavin deficiency. Some symptoms of niacin deficiency, B6, folate, and then B12, vitamin C, and iron. And this can kind of go in their lab coat, or they can carry it with them, however works best for them, just as a quick reference back to the nutrition-focused physical exam and what they learned in their PowerPoint. Next slide, please. Based on this information, I created several recommendations, including that the registered dietitian should continue to conduct a full comprehensive exam of anthropometric, biochemical, and clinical data. The dietitian should be trained on the importance of the nutrition-focused exam and how to conduct it. The dietitian should utilize the basics of the nutrition-focused physical exam to identify residents with malnutrition and those at risk. And that the Credentialing Board of Dietitians, which is the Commission of Dietetic Registration, should provide continuing education tailored to dietitians working in long-term care and how to conduct the nutrition-focused physical exam. So how will I use this information for my practicum? I think this is going to be hugely valuable to me. I work in 31 long-term care facilities while I only conduct it in 5. Those ones closest to my house that I can get to the quickest without travel and such. So I oversee 31 that are in the Alabama and the Panhandle region of Florida. I have 11 dietitians that I work with on my team, so I'm able to help them share this information with them. I also work with a regional dietitian in South Carolina, so I can share this information quickly with her. She's kind of my counterpart. And my company is located in 48 states, so I'm hoping to be able to expand it and keep sharing it at company meetings with other dietitians and just spreading it to improve the dietitian's training and how the dietitian assesses patients for malnutrition in the long-term care setting and improving the quality of care and making sure that we can treat things early and just identify problems as early as possible. So I'm really excited to progress with this. Thank you so much.